today's exclusive interview on addressing the needs of breast cancer patients during COVID-19 pandemic. Today, for this exclusive interview, we have one of the eminent medical oncologists, Dr. Akshay Shivchhand, who is a consultant medical and pediatric oncologist and hemato-oncologist at Apple Cancer Institute, Kolhapur. He holds a gold medal with the Dr. T.B. Patel Young Research Scientist Award for presenting a research paper during Hospital Week celebration 2018 at the GCRI Ahmedabad. He has special interest in treating carcinoma of breast, carcinoma of lung, lymphomas, childhood leukemia, and multiple myeloma with special interest in immunotherapy. We welcome you, Doctor, for this exclusive interview and thanks for sharing your valuable time with us today. Doctor, how to tackle this situation and what challenges you are facing every day?
Hello all. Thanks for those kind words. As we are seeing that COVID-19 pandemic has spreaded all over the world, and being the second populous country in the world, India is not an exception. And this COVID-19 pandemic hit the cancer patient. These are the high risk patient. So the consequences of COVID-19 in cancer patients, especially breast cancer patient, are more. And this is the difficult situation where for the tackle of this COVID-19 along with the breast cancer patient. So challenges I am facing every day as I am practicing in Kolhapur. Now the cases of COVID-19 in Kolhapur, they are on rise. So in this, we are day to day facing a challenges like when to call the patient, when to not to call the patient, what are the personal protective equipment should we use, and also we insist the patient to use the personal protective equipments like face mask and to maintain the social distancing. As well as in our OPD, we are taking utmost precautions for tackling this situation, and we are seeing the patient. So these are the challenges I am facing in every day while tackling the COVID-19 along with the breast cancer patient.
How will a patient be able to connect with oncologist or hospital?
When the COVID-19 situation was not there, patient can easily be connected with oncologist or a hospital in a personal way. Like patient can come to the hospital, show to the doctor and hospital, and this was the usual scenario. But this COVID-19 pandemic has led us to find more ways of connecting to the hospital or oncologist, such as patient can consult on telephone, like that is called as teleconsultation to the oncologist or a hospital. Or if a patient has emergency situation, patient can directly come to the oncologist or a hospital to seek an advice and to seek a treatment.
When to see a doctor?
Yes, that's an important question. A patient of a breast cancer can see the doctor in certain situations, like a patient who is very young patient and patient is having lump in her breast which was there for a few months or a few years, and now suddenly it has started rapidly growing. It has started fungating. There is an extra lump in the axilla, or there is a bloody discharge from a nipple. In this situation, patient can see to a doctor. Another, if patient had some symptoms apart from breast lump, like patient has breathlessness, patient has high grade fever with the breast lump, or a patient is having severe backache, in this situation, patient can directly see a doctor.
What symptoms would want immediate emergency treatment?
For the breast cancer patients in COVID-19 situation, NCCN has divided the breast cancer patient in 3 categories, A, B, and C. Those A category patients, they need immediate adequate treatment. So what are these patients, or who are they? First, the patient who is having breast abscess and patient is having signs of septicemia and sepsis with high grade fever, malaise, nausea. These are the this is one of the patient who can warrant immediate emergency treatment. Secondly, the patient who is on chemotherapy and started having severe grade 4 mucositis, high grade fever, low WBC count, such as like all this situation called febrile neutropenia, these patients should come and should warrant immediate emergency treatment. Also, in this COVID-19 situation, the patients who are on chemotherapy and started suddenly breathlessness, high grade fever, sore throat, running nose, anosmia. These are the symptoms where we can suspect there is active COVID-19 infection in such patient. They should seek an immediate treatment.
Should a patient delay her treatment, surgery, or radiation therapy, or else how should she be shifted to oral medicines?
To answer these questions, again, I would like to say the NCCN has given clear-cut guidelines of dividing the patients of breast cancer into three subgroups like category A, category B, and category C. So the category A patient, as I have said, they should seek an immediate treatment. In category B, there are subgroups of patients where we can delay the surgery or we can delay the radiation. But in these patients, we can give neoadjuvant chemotherapy to buy a time where we can delay the elective surgery. Like in this category, the patient are of early breast cancer patients who are triple negative, HER2 positive patients where delaying the whole treatment is not an option. In these patients, we can try giving neoadjuvant chemotherapy so that the surgery in such COVID-19 area will get postponed and the patient will also get benefit of chemotherapy. The category C patients where there is only a lump on a biopsy, it is like a DCIS component, or a mammography, it is a DCIS component. It is low growing lump. Patient's age is around 65-70. It is strong hormone receptor positive, HER2 receptor negative, or not a triple negative breast cancer patient, where we can delay the surgery for of around 2 or 3 months. But in this delay, we can advise the patient oral medicine in the form of hormonal treatment in such a patient, where that can act as a neoadjuvant hormonal treatment also, or it can halt the progression of a disease so that patient not turn into the stage 4 disease, or in that patient we can halt the disease progression. So these are the some way where we can delay the treatment, but to choose a patient who can delay the treatment is patient on patient basis. So we cannot apply this rule to every patient of a breast cancer where the delay is an option. Like suppose I have already told a young 34 or 40-year-old patient with a lump in her breast with a triple negative morphology on a biopsy with high grade tumor, to delaying the surgery or any form of treatment of breast cancer is not advisable in such a patient.
What about mammograms and other routine screenings?
For these mammograms and other routine screenings, ESMO, NCCN, and American Society of Clinical Oncology, that is ASCO, they have given the guidelines like you do the mammogram like if it is a diagnostic mammogram, like patient comes to you with a lump in her breast and now you are planning for a treatment and you need a mammogram, then don't delay these mammograms, get it done mammograms so that you have an idea about the multifocality, multicentricity of a breast lump so that you can plan the treatment accordingly. But the routine screening, like a normal patient where there is no lump in her breast and patient is postmenopausal, more than 45 years of age, as per the guidelines, patient is advised to do yearly routine mammograms or a screening. These patients we can postpone, or we can postpone the screening mammographies in such a patient, and by postponing this kind of screening will not have any detrimental effect on a patient's health. So yes, we can postpone this kind of screening mammograms in such a COVID-19 situations where there is a direct contact to the healthcare facility and the patient can get infected with the COVID-19 virus, coronavirus.
What a patient needs to do if she is having an urgent appointment scheduled.
If a patient has an urgent appointment schedule, and if she can come to the hospital or she can meet to her oncologist, then it is advisable that she should come and seek an advice. But if she is living far away from the hospital and there is a high risk that patient can get COVID infection, in this situation, patient can communicate with the oncologist on in the form of teleconsultation on a telephone, so that the needs of the patient can be fulfilled. If possible, the oncologist can advise on phone what to do, what are the investigations should be done, and what are the treatment necessary for that emergency situation. Patient can take from nearby hospital or from nearby doctor, and the patient visit to the hospital can be postponed.
In a patient of breast cancer, how much higher is the risk of severe consequences of COVID-19?
For this matter, each and every cancer patient is an high risk for a COVID-19 related complications, and the breast cancer patients, they are no exception to this rule. But as we compare to the lung cancer patient, the chances are less than the lung cancer patient. But yes, there are the chances that these patients can acquire COVID-19 infection, and there is a more chance that patient can have multiple complications regarding COVID-19 infection, such as bilateral pneumonitis, hypoxia, septicemia, secondary sepsis, then the thromboembolic phenomenon. As these patients of breast cancer, they have lower immunity, the consequences of COVID-19 infection and the complications, they are much higher as as if we are comparing to the normal population, they are as high as 70%. In the patients who are breast cancer patients, they are on chemotherapy and on treatment in any form, like whether it is adjuvant therapy or a metastatic therapy or any radiation therapy. So these are the patients, the consequences are much worse than the general public.
What are the safety precautions or care she should take at home during this COVID-19 situation?
The safety precautions one a breast cancer patient should take at home, they are, firstly, they should be in the home. They should not visit unnecessarily to the other areas. They should not expose themselves to the environment where there is a chance of getting COVID-19 infection, like a crowded places. Even if they are going out, they should maintain the social distancing. They should wear a mask. They should maintain the healthy diet in the form of, there should not be raw vegetables in the diet, there should not be raw foods in the diet, there should be adequate hydration, as well as patient can have the like vitamin C tablets in the in her daily routine. But to avoid contacts and social distancing and using a personal protective equipment, like either in the form of face mask or a face shield, these are the measures where we can definitely avoid COVID-19 infection to the some extent. Patient will not get exposed to the COVID-19, and the complications of a COVID-19 infection in a breast cancer patient can be avoided.
Thank you very much, Doctor, for upgrading us with such valuable knowledge, and it will surely be a great help to cancer patients.
Thank you so much for giving me this opportunity to communicate with our breast cancer patients who will require this type of knowledge and precautions in this COVID-19 pandemic. So thank you so much.